Dr. Ritesh Anand. He is having 20 plus years of experience in doing cosmetic procedures.
First of all, let me clarify, liposuction is not a weight reduction procedure. It is a body shaping or a body contouring procedure. Till today, it is one of the most commonly performed cosmetic surgery worldwide.
So, who is the ideal candidate for liposuction?
There is no as such age bar for the liposuction.
Like in general, we also hear about tummy tuck surgeries or abdominoplasty.
Patients usually get confused between liposuction and tummy tuck.
So how different is liposuction when comparing both these procedures?
Liposuction is mainly for those patients who doesn't have any excess skin. Especially in India, also patients are getting a lot of liposuction performed these days.
So is it possible to get a six-pack? Hi everybody, this is Dushyant from MedSurg India, and today we have with us Dr. Ritesh Anand from Centre for Aesthetics, Gurugram. He is having 20 plus years of experience in doing cosmetic procedures. So welcome Dr. Ritesh Anand. Can you briefly explain what is liposuction?
Liposuction is basically a cosmetic surgical procedure in which we try to remove the abnormal fatty deposits from under the skin and above the muscles. It is usually done in patients who have abdominal fatty deposits which are resistant to diet and exercises. These fatty deposits of areas can be in the tummy areas, it can be flank, it can be thighs, it can be hips, or it can be arms area.
So who is the ideal candidate for liposuction?
Any adult patient who is medically fit to undergo any kind of anesthesia is a good candidate for liposuction. And again, any adult patient who has good skin tone and have good muscle tone also is again a good candidate for liposuction. Anybody who is willing to lose few inches around their waist area, around their thigh area is again a candidate for liposuction. There is no as such age bar for the liposuction. And any patient who is willing to follow a healthy lifestyle in the future after the liposuction procedure is also a good candidate for liposuction procedure.
Like in general, we also hear about tummy tuck surgeries or abdominoplasty. So how different is liposuction when comparing both these procedures?
This is a very good question. Patients usually get confused between liposuction and tummy tuck. Liposuction is mainly for those patients who doesn't have any excess skin. They can have little bit of laxity on their skin, but the skin laxity is not too much. But in patients like who are post-pregnancy, who have lost a lot of weight, they have a lot of loose skin, their skin quality is not good, they have a lot of stretch marks also. They are not good candidates for liposuction because liposuction will not tighten the skin to that much extent. So they will require some excisional procedure, some cutting kind of a procedure, some lifting procedure. In that, the tummy tuck will play a major role. Liposuction is strictly for all those patients who have few abnormal fatty deposits with good skin tone, and the skin will shrink or retract automatically once we remove that fat out. So there is a big difference between choosing a candidate between liposuction and a tummy tuck.
So tummy tuck could be an ideal option for those who are above 100 kgs or who are in the range of 120 or 150 kg.
Patients who have massive body weight beyond 100 kgs or they have a lot of loose hanging pannules of fat also. They have a lot of hanging skin also along with the fat also, and they are usually bothered by that hanging apron of skin which is hanging in their low tummy. So that, yes, definitely tummy tuck can be a very good option. We can remove that hanging apron of loose skin from below their tummy and below their belly area, and they can have a very good quality in the quality of life after this procedure. Yes, definitely it usually helps in those patients.
Okay. So what are the myths involved with liposuction?
One of the most commonest myths involved with liposuction is that liposuction is a weight reduction surgery. First of all, let me clarify, liposuction is not a weight reduction procedure. It is a body shaping or a body contouring procedure. You cannot reduce weight. Although some amount of weight is always reduced when we do a liposuction, but that is not the aim of liposuction. It is just a byproduct of liposuction. So it is not a weight reduction procedure. Secondly, patients are usually worried that it is a very painful procedure. It is a very dangerous procedure. With the current technology which we have in terms of the technology which are used for anesthesia purposes and the technology which are used to remove the fat, They are very safe. It is a very safe procedure. Anybody who is medically fit can undergo this liposuction procedure very safely. There is no risk to life with this procedure. It is a safe procedure.
Okay, so in the recent months or in the last few years, have you seen the trend of getting this surgery done on the increasing side?
Yes. Liposuction is, till today, it is one of the most commonly performed cosmetic surgery worldwide. Even if we talk about the figure of International Society of Aesthetic Plastic Surgery, there also it is consistently becoming #1 surgery which is being performed outside all over the world, and especially in India also patients are getting a lot of liposuction performed these days. So yes, the trend is very upcoming, and as the surgery is also becoming more and more safe, the new technologies are coming daily on a daily basis. So yes, there is a definite upward trend toward this surgery.
And when you compare female or male, who is getting this done more?
See, this is again a myth that liposuction is only for female patients, but in the recent years we've seen that the majority of the female patient as well as the male patient both are equally coming for this surgery. So there is no stigma attached to it that it should be done only for the female. It is good for both the males and female patient. But the goal is little different in male and female patient. In male, they usually are asking for an athletic body like 6 packs also. But in female, they are looking for an hourglass kind of figure. So the goal of the surgery is little different, but the technique is same for both.
So is it possible to get a 6-pack?
Yes, it is definitely possible to get 6-pack in male patient, but we have to select those patients with a little caution that the patient should have some amount of an ideal, this much amount of body fat. He should be willing to follow a healthy lifestyle. He should be willing to have exercise regime after the liposuction. But yes, to answer your question, it is definitely possible to have 6-packs.
So like in general, if somebody like me who is going to the gym or somebody who's reducing weight in the gym, and they feel like they are not able to get a 6-pack, and they reach out to you. So is it possible to get 6-pack?
Yes, it is possible to get 6-pack.
It's a great news.
Yeah. With ultrasonic kind of a liposuction with laser technology, we can precisely carve your abdomens and remove the surrounding area fat. So we can definitely give you 6-packs abdomen.
That's wonderful. So after undergoing liposuction, you have to wear some pressure garments.
Yes, the pressure garment is a must after the liposuction procedure. Pressure garment is important in the last step of liposuction surgery. We usually tell the patient that this is the last step which as a surgeon will not be performing. You will be performing this procedure, that you will be wearing the pressure garment. Why pressure garment is important? That once we remove the fat from under your skin and above your muscle, we are potentially creating a space in those areas. So what pressure garment does is it decreases that potential space, and it helps your skin to get stuck to your underlying muscle, so that you get a better contour after the procedure. So this is the one aspect of it. Second is that the pain after the liposuction is because of the shearing of your skin, because of the movement of your skin and your muscles. So once you wear the pressure garment, that movement is gone, and patient feel totally pain free after this. Their level of activity improves a lot. So pressure garment is must. Pressure garment also helps in bruising resolution fast. It helps in decreasing the swelling also, which usually comes after the liposuction. It avoids hematoma or the seroma, which is a kind of a fluid collection which can happen in few patients because of this. So pressure garment should be worn religiously after the liposuction, at least for 4 to 6 weeks, depending upon
this helps in getting the results better.
Yes, it helps in getting the results better. It helps in the faster recovery of the patient also.
Okay. So what are the various techniques in liposuction procedures?
There are a lot of techniques of liposuction. First of all, initially how it used to be done was, we used to call it a SAL, or a suction assisted liposuction, or a conventional kind of a liposuction, in which we used to use hollow cannulas with openings at one tip and a suction tube attached at one end, and with the to and fro motion of the cannula, the fat used to get avulsed from its location and get sucked by that tubing. This was the crude and the conventional kind of liposuction. The latest technologies are PL, or the power assisted liposuction, or the UL, or the ultrasonic assisted liposuction, or the laser technology. In the power assisted liposuction, it is a vibration kind of a thing which is breaking the fat and then it is being sucked. But out of all technology, UL or the ultrasound assisted technology or the laser technology is the best technology, because the cannula which are used in this UL these are blunt cannulas. They have 2 or 3 rings or 1 ring at their tips, and via these rings ultrasonic waves are emitted, and those ultrasonic waves gently emulsify or gently breaks the fat, gently melts the fat, and it is then in the second process gently with a low pressure device gently sectioned out of the body. The advantage of doing it gently is that there is very minimum amount of trauma on the body of the patient, so the recovery is very fast. The pain is almost negligible. There is minimum amount of bleeding, and since the ultrasonic waves has a property that they help in the shrinkage of skin tissue, and this ultrasonic technology is used in other body areas also for tightening the facial skin also. The same ultrasonic waves are being used in this technology also. So it tightens the skin also.
So basically, these are the two main methods
Yes.
that have been there that most of the surgeons are using. That is a conventional method,
Yes.
which is more of a suction where you suck the fat,
Yes.
and the other one is the ultrasound
Ultrasonic,
assisted.
yeah. Out of these, the ultrasonic is the best because it has a lot of other advantages also.
So is it the same way like when we do a normal surgery and then we do a minimally invasive procedure like that? Let's say in cardiac
Yeah.
surgeries as well, we do a CABG.
Liposuction is otherwise a minimally invasive surgery also because there are no major cuts given. The cuts which are given are just 3 to 4 millimeters long, and these cuts usually heal within a day also. So it is it is definitely a minimally invasive surgery.
So you offer both these procedures, like the patients have to choose, or you choose the patients, like who is best for which procedure?
We normally offer both the procedures depending upon the requirement of the patient. We suggest the patient that he or she should take this procedure, whether to go for a conventional liposuction or an ultrasound assisted liposuction. But looking at the majority of the patients which come to us, we normally offer them, majority of them, the ultrasonic assisted liposuction only because that is the one which gives the best results with liposuction.
Okay, so let's say somebody who is planning to undergo a liposuction procedure, what they have to plan? Because as a patient, somebody who is planning such a procedure, they also need to undergo some kind of planning. What should they plan?
We get a lot of patients who are planning for liposuction maybe 1 or 2 months after they are consulting us today. So we ask them to follow healthy lifestyle from today itself because it is a non-negotiable step which they will have to perform in the future also. If they are smoking, we ask them to quit their smoking at least 2 weeks prior to the surgery. They should be, if they are on any kind of a blood thinner or if they are taking a lot of green teas or any herbal products which can cause some bleeding, we ask them to at least stop them 2 to 3 weeks prior to that. So that is how we tell them to follow or tell them to prepare their body for the upcoming liposuction procedure.
So like someone has to also lose some weight, is it necessary?
It is not necessary, but if somebody is in the process of losing weight, we ask them to lose as much as they want and then go for liposuction because then only it will give the best results.
Now, choosing the right center for liposuction, what all they should see in the clinic or in the hospital, wherever they are planning to undergo this surgery?
So it should be a safe facility basically. There should be a best technology available for the liposuction. The surgeon should be experienced. Surgeon should be well versed with the procedure. He or she should be the one who is doing this procedure on a routine basis. And the type of anesthesia which is being given there, whether it is being given by a certified anesthetist or not, whether they have all the facility, they have all the backup facility also there. It should not be a daycare kind of a center. There should be a facility of at least staying there for a day or two if there is a need, because majority of the patient we do it on a daycare basis. But if you are involving a bigger area, if you are doing a 360 liposuction or a thigh area, and if you are combining 2-3 areas, there should be facility for the patient to stay there also. So safety of the patient is of prime importance. It should not be done in a hurry kind of a thing. He or she should take a consultation with the surgeon first. He should see the result of the patient, the previous results of the patient. The patient should discuss with the surgeon in detail what kind of result the patient is expecting, what kind of result we can also offer. We also discuss that with the patient. We also advise some blood tests also, so as to understand the safety of the procedure. All your organs are functioning properly or not. That is, first of all, everything is done. Then only we give you a date or consultation kind of.
So you can also deny this procedure for someone.
Yes, if the patient is above 45 or 50 years of age, he or she is not medically fit. He has some chronic uncontrollable disease like uncontrolled diabetes, uncontrolled hypertension, or he is a cardiac patient of a bypass surgery. We can definitely say no to this patient because liposuction is a cosmetic surgery and it will not be safe for that patient.
So once someone has undergone a liposuction procedure, what lifestyle changes he or she should do?
First of all, patient should be willing to follow healthy lifestyle by following himself, having an active lifestyle, following a proper diet kind of a thing, and following some exercise regime. It should not be a very hard kind of a thing that he has to follow this particular diet or he has to do this much of exercise, but it's in totality he should have an active lifestyle after the liposuction. He or she should have a stable weight after the liposuction. 1 or 2 or maybe up to 3 kgs of weight fluctuation is acceptable for us, but patient should not gain too much of it, because even after the liposuction, if you gain too much of fat, you can gain fat not on that particular part where we have done the liposuction, but the other body parts area. So we should be willing to have a healthy lifestyle. That is of prime importance after the liposuction.
So basically, even anybody who undergoes this procedure, they have to maintain a good diet regime.
Yes.
And it is not possible that once you lose some weight through this procedure, he or she would be at the same weight throughout.
Yes. Little bit of weight fluctuation is advisable. It is recommended.
So how much weight in general everybody is losing through this procedure?
See, the safe margin for losing weight while liposuction is 10% of your body weight. If suppose somebody is 80 kgs, and at the maximum we can do this liposuction is to reduce that fat of 8 kgs. If somebody wants to reduce more weight with this liposuction patient, it has to be staged. It should not be done in one go. For one go, it is maximum advisable amount is 10% of your body weight. But if we do it after 3 months, maybe after 6 months, yes, we can.
So basically, it is a guideline. It is a protocol that every surgeon has to follow.
Yes.
Okay, that's very important for everybody who is planning to undergo.
Like in some countries, it is fixed also. Like in UAE and other countries, it is fixed that you cannot take out more than 5 kgs in one session.
Okay.
So session gets increased. But
so they can do multiple sessions.
Multiple sessions are allowed after, because that will not compromise the safety of the patient.
So how much gap is being,
minimum 3 months.
3 months gap for every procedure. Thank you, doctor, for giving such valuable information, and I hope you all have enjoyed watching this session, and we'll be back soon with more sessions like this. Thank you.
Thank you.